Welcome to Frontline. We continue to celebrate our frontline workers, and of course we're hoping that very soon government will come out with the real clear-cut category of who fits into the frontline workers and who will benefit from all of those juicy promises being made to them. Today we've been talking to some frontline workers. We'll bring that to you shortly, but we remind you that your doctors and health workers need you to stay at home. He says to pray for them, and certainly we urge you to send those prayers to us on our WhatsApp platform. We'll put them together and play it back to them so they know. Dr. Mpoma, the last person who spoke, was meant to speak to us today about his own experiences here on Frontline, but he's had an emergency and he's had to go take care of it. But today again on Frontline, we're focusing on leader of Ghana's coronavirus testing team. Dr. Samuel Kaba Akoria has been speaking exclusively to my colleague Latif Idrisu about the work they've been doing in terms of testing people for coronavirus and how, or the possibilities that exist for us here in Ghana.
Talk of frontline health workers delivering healthcare to Ghana's COVID-19 patients, and you find them right here at the East District Hospital. Here is the center. This is where most of Ghana's COVID-19 patients are being held. The tape you find behind me separates proper frontline health workers and their clients from auxiliary or secondary frontline workers like myself. In here, the nurses and doctors are racing against time to save the many lives that are in the building behind me, currently battling with the deadly COVID-19.
With these appropriate actions taken is to contain this. So if you even see of late, our numbers have not been increasing. We're in 204, we moved to 214, and we are still 214. It will go a little high, but we don't expect it to go much than the system can contain.
Is that a hope you are expressing, or is what is going to happen?
You see, this is what will happen, right? When you lock down and you start testing, the more people you test, you might get more positives, right? So I will not be surprised to have more cases positive, because that is the purpose of locking down, to identify them early. And then you prepare yourself for that. But it also gives us that window of breath that the next 2 weeks we should be having less, because we had locked those at home.
Yeah.
So it's not only a hope, and of course hope is the last thing you lose. I do have that hope, but it's also reality that measures of containment has been taken at the appropriate time for us not to go to the thousands.
So Dr. Kaba is confident Ghana will not hit the thousands when it comes to patients. When do
if we continue the way we go and the way we are doing things.
When should you expect the curve to flatten? Okay. How soon should, or would Ghana's curve flatten?
Okay, I'll help you with that in a way so that you understand. In every country, whatever it is, you always get a peak and then it starts to drop, right? And it doesn't drop to zero. It will drop to some extent, because some people would have developed immunity to it. Some people would have been cured.
Health workers undergoing training here to be put on the front line of the COVID-19 fight say they are unfazed with the dangers associated with the deadly virus.
While others will call it a risk, I would want to call it a privilege. All over the world, other staffs, I've seen other nurses who are also sacrificing to help our colleagues who are having this ailment or this suffering from this pandemic. And so I'm just want to take the opportunity to also help people who are also vulnerable. Yes.
You have no fears of contracting the virus?
Well,
as has been reported that frontline health workers contracting. We know a couple who have already tested positive.
Well, there are fears. Of course, all over the world, a lot of people have fear, but that's why I'm trained. Part of the training demands that you allay your fears, you put your fears away, and then the main point is that you are helping someone to recover, and in that way you're also helping yourself. So I think that's why I still want to call it a privilege. There are fears, but as time goes on, we are able to overcome the fears, and then we help our patients.
So you give us your name?
My name is Samuel.
Samuel, tell us the peculiar fear that you also have going into this battle.
Actually, because it's something like a worldwide something spread, definitely there will be a little fear inside. Definitely, no matter who you are, there's a fear that you can encounter. There's some little fear that will come your way. But as a health worker, you should rather take away the fear and know that you are in for this, and it's a passion. And since you are a nurse or a doctor or a health practitioner, you know that this is what you're up to. So you have to just face it and get trained and help combat this spread. So
how long do you envisage to be at the front line in this battle? Have you done your projections and say that by May or June, July, I should be at home with my family, not having to go back to the front line? Have you done that projection on at a personal level?
At a personal level, I say we just leave everything to God in prayers. No, we haven't made any specific projections about the time that this spread will just vanish, but we are hoping and keeping all the faith and adhering to all preventive measures and precaution measures, that by as far as the Lord lives, everything will be well.
Then final from you give us your name first.
I'm Madam Jennifer Wari.
Okay. Tell me about I asked him about whether or not he has projected how long he's going to be in this battle. Have you also projected how laborious it is going to be at the front line?
Not really, but as he said, the battle is a lot. And then as a health worker, you should be ready for anything, because it could be your family, it could be your partner. Anybody can be there. So supposing I was the one there, I would need somebody to care for me. So I think that we are just doing it with a free will, not thinking about anything. That's all.
And are you ready to accept postings to any of the centers holding your clients to be clients?
Of course, that's the main reason why we are here. Of course.
And have you also projected how long you're going to be at the front line?
As long as it takes, we are here.
As long as it takes?
Yes, please.
Thank you very much.
You're welcome.
And this is your Frontline here on The Pulse with me, Gifty and Apia. Certainly we'll look at what concerns the people who are at the front lines of this fight, be it health workers, be it security workers, whatever it is you do that expose you exponentially to contracting this disease. We talk about it here on Frontline. So you've heard some of them share their fears with us, but the fact that they feel trained, they're psyching themselves up to even go to the front line. Thank you to all of them. Do send in your thoughts, your encouraging words for them to our WhatsApp platform. Of course, the number is 0540109009. We'll package them and play them for all of them to see.